All right, Dr. Levy, thank you very much for joining me today. Um, it's an absolute pleasure to have you here.
My pleasure to be here, Reese. Reese or Reese?
It's Reese.
Reese,
Reese.
okay. There we go.
Yeah, I'm glad you actually said that because a lot of people confuse my surname with my first name. They call me Barry instead. So I'm glad that you said Reese.
Sorry.
Yeah, no, I'm really excited and eager to get into today's conversation because over the last few weeks or so, I've come to learn a lot about methylene blue and its incredible, uh, benefits, which I'm excited for you to discuss on this channel. So very quickly on this channel, I try and share as much of the truth as possible, and in various areas, health, whether it's politics, whether it's business, whether it's whatever it is. I want to be able to push great information to people. This particular area of health now, which I'm deeply fascinated by. I've come across this methylene blue. I've started taking it myself and experiencing the phenomenal benefits. And it's just doing great things. I'm hearing great things from people as well that have also taken it. And then I come across yourself, Dr. Levy, on YouTube, and you, in all honesty, what you said about the benefits, the science behind it, and even vitamin C as well, because I know you're an absolute expert on vitamin C, which I'm excited to hear more about from you. Um, Before we get into the details of what all this is, would you mind for the audience just uh, giving a bit of background on who you are, and sort of what your expertise are?
Well, I'm a cardiologist, author, and lawyer. Been a cardiologist for about 40 years, a lawyer much shorter period of time, about 20. And I was, shall we say, a traditional cardiologist until about 1993 when I met Dr. Hal Huggins, who I consider to be the major first biological dentist on the planet. And anyway, to make a long story short, he asked me to come to his clinic. This is in Colorado Springs, Colorado, to see what he was doing. And it was there that I just saw, shall we say, medical miracles, stuff that medicine had never taught me was possible and claimed was not possible, using things that are consistent and effective and not a single word mentioned in textbooks of medicine or manuals of medical therapeutics. So that was enlightening and upsetting at the same time. And I saw on one patient in particular, a little old lady with an advanced neurological syndrome, getting a lot of dental work, and she was getting more and more and more animated and energetic as she had more and more dental work done, and it just didn't fit. And Dr. Huggins came in, and I said, "What's going on? Why is this lady getting so much better so quickly?" And he pointed at the IV. And I said, "Okay, well, that's interesting." And he said, "It's what's in the IV that counts." I'll say, "All right, tell me." He said, 50 grams of vitamin C. And it was like in the blink of an eye, I said, my medical world is not the same. And at that point in time, I began my roughly 4 years of research on the literature until I finally wrote Vitamin C, Infectious Diseases and Toxins, Curing the Incurable, with over 1,200 different references. And at the same time, of course, I was appreciating the enormous amount of damage that dental toxins and dental infections were doing to patients that was being completely ignored by quote unquote traditional or modern dentistry. So I worked with Dr. Huggins a few years. I saw how Dr. Huggins was so completely harassed all the time by ridiculous legal situations that I actually decided to become a lawyer as well. Maybe the lamest reason in the world for becoming a lawyer, but I became one nevertheless. And then since then, I've written about, I guess, 12 more books and done a lot of lecturing, a lot of education courses, have not continued to practice cardiology, at least not in the traditional sense, and don't have a clinical practice. All my experience now, if you will, is arm's length. These days, people and docs from literally around the world write me and tell me of their situations. I tell them, well, now I can't do a consult on you, but here's some information and put them in the right direction. And so that's pretty much where we stand today.
Very interesting, actually, because that story there provoked quite a few thoughts in me about just the way traditional medicine is, and the things that we're not told about our health, and basically just how simple health can be. Obviously, there's complexities to it. Everybody's different, but it's my belief now, on the whole, and through my own experiences, that health can be very simple. As long as you put in the right thing to the body, vitamins and minerals, etc. Perhaps a few herbs as well. That everybody can experience that feeling of well-being and good health. Particularly now with this methylene blue as an added booster, which we'll get into in a second. But I'm curious to know your thoughts, actually, before we progress, about vitamin C. You mentioned vitamin C. So I guess you'll be familiar then with Dr. Linus Pauling.
Sure.
Yeah, absolutely. Because I'll tell you a little brief story. So I was involved with a health product about 10 years ago. It was called Vima. It was based in the States. It was an acronym for vitamins, essential minerals, mangosteen, which is a superfruit from Southeast Asia, and aloe vera. It was a combination of all these things. And I got to learn about Dr. Linus Pauling and, all of his marvelous, just all the stuff that he came up with and his advancements in vitamin C and everything else. Would you mind just explaining about the importance of vitamin C on the body?
Well, vitamin C is the primary antioxidant in your body. There are many, many things that have antioxidant ability. The significance of having a lot of antioxidant, like vitamin C in your body, but other antioxidants as well, is that they give electrons back to oxidized biomolecules. Oxidize means an electron was taken away. And you take an electron away from a biomolecule, you inactivate. So really, all disease is how many biomolecules have been inactivated by oxidation, where are they located, where are they concentrated. That's what determines what disease you have. And what oxidizes biomolecules are toxins, nothing else, toxins. That's it. That's the end of the story. Toxins damage you and biomolecules by oxidation. So vitamin C can come in and restore the damage, restore the health of the cell by reducing the biomolecule, giving you the electron back. And of course, at the same time, and this is where all the dental stuff comes in, you need to stop the new toxins from coming in. As Dr. Huggins told me many times, he said, Tom, you can't dry off while you're still in the shower. Okay, so it's not enough just to repair the old damage, obviously, or it should be obvious. You need to prevent the new damage that's occurring on a daily basis, which almost always comes from the mouth. So when I first wrote the book, Vitamin C, Infectious Diseases and Toxins, Curing the Incurable, I thought about this long and hard because it was very clear empirically in the literature, in my clinical experience, and Dr. Huggins' experience, and other clinicians that I talked to and interacted with, that high-dose intravenous vitamin C would absolutely pull you out acutely of any poisoning or toxic situation. Didn't matter what the toxin was, didn't matter what the poison was. And I said, how on earth can one simple molecule neutralize the toxicity of thousands or hundreds of thousands of other molecules, all different in size, shape, and manner, with all different toxic presentations, toxic clinical syndromes, but it did it. So I said, the only logical explanation is that vitamin C is reversing the final common denominator of what makes a toxin toxic, and that is oxidation of biomolecules. And this is why vitamin C universally is good for any condition. It's not going to cure the condition if you haven't taken care of the toxin source. But if you have taken care of the toxin source, many times vitamin C can completely resolve these conditions, because when you stop damaging the tissue chronically and long term, and then bring in antioxidation to bring the biomolecules back to their normal state, you have health. And of course, this is supported in the literature directly and indirectly by probably some 80,000 articles on vitamin C. That's another thing, too. I told you about the medical textbooks. There you have it. 80,000 articles on vitamin C and everything it does in esteemed research laboratories around the world, esteemed medical institutions, but it's not in the medical textbook. I mean, my humble opinion these days, especially after the pandemic, if anybody has their eyes open, is modern medicine not only does little good, little of the time, it does a lot of harm. It does a lot of harm because not only does it promote toxic pharmaceuticals at the same time, and I can't tell you how many emails I've had over the years on this, it actively suppresses and ridicules things like vitamin C that could take people out of septic shock, which kills most people when they're in the hospital, for example.
I totally agree. I totally agree. The what you said there about the pharmaceutical industry causing more harm than good is absolutely spot on. I mean, I did a.
And I want to make it clear: there are some pharmaceuticals that are good. There's just not many of them. There's a few of them that, by chance, perhaps, maybe by design, actually do things that are good for your physiology, but they're very few. Calcium channel blockers, for example, are very good, but there aren't many legitimately good pharmaceuticals that cannot be completely supplanted by appropriate diet and supplementation regimen. But I don't want people to think that it doesn't have a role. I mean, as a cardiologist, if you have high blood pressure, don't get crazy and think you're going to get a machine that's make your blood pressure better, or changing your diet is going to make your it might make it better, but it's not going to resolve it. So if you have a significant high blood pressure, definitely get on a regimen of pharmaceutical agents, because you keep that blood pressure up, you shorten your life in many different ways. But that's the exception rather than the rule. All the other things are really superfluous and often harmful.
Yeah, I mean, because when it comes to pharmaceuticals, I'm very skeptical to begin with, because they're foreign. It's foreign agents, right? They're not
absolutely.
They're not chemicals that are found in nature, and I'm more of a naturalist more than I am a pharmaceuticalist, if that's the word. You know what I mean? And when I came across methylene blue, so I discovered this from a guy here in the UK who is a naturalist, but he sells supplements, vitamins and minerals, and he couldn't say enough about methylene blue. But then he said something which I wasn't expecting. He said it's a pharmaceutical product, so it's not found in nature, and I was quite shocked by that, and obviously, skeptical. But as I dug deeper, I was like, wow, this is actually something quite profound. And particularly when I found your interview then with on the Reardon Clinic. Did I say that correctly?
Oh, yes, that's correct.
And what you said there, it blew my mind completely. And it was exactly what I was looking for, because I was looking for a cognitive enhancer and nootropic. And since I've been taking it, Dr. Levy, I've found it's definitely worked 100%. So let's go into methylene blue. Can you talk about what it is, and we'll go into more detail, but more specifically, what methylene blue actually is?
As you just mentioned, it is, shall we say, unique especially in light of what we were just saying, insofar it is a synthetic agent, okay? It's something that was made in a laboratory. Most of the time, that's not good, but hey, every now and then, if you apply the chemical principles correct and you have something that can exchange back and forth electrons like a good antioxidant, lo and behold, you have something like methylene blue.
Can I just ask very quickly
out,
as well, Dr. Levy?
Sure.
Can I just ask? Um, so usually with a pharmaceutical drug, right, we can find a benefit in there, but what comes along with it is all the side effects, right?
Right.
But we don't see that with methylene blue. On the whole, really, it's actually very, very good for your body. Which I know you're going to get into in a second. Why is that? Why does our body love this molecule so much?
In a nutshell, because it's a small molecule, it's amazingly enough both water and fat soluble, so there's no particular compartments of the area it doesn't get into. It gets much quickly taken up into the central nervous system, unlike many other drugs, agents, and even natural agents that have a typical time with the blood-brain barrier. And it's a premier antioxidant that goes back and forth between its reduced and oxidized states very easily, just like vitamin C. It might almost sound like heresy to say this, but as I studied more and more on methylene blue, myself, family, friends, physicians, and other people that have talked to me about it, it actually has pretty much the same clinical profile of benefit as vitamin C, with some areas of superiority. The superiority, which you already alluded to, in how you feel and how you're thinking and your clear-headedness, that's what methylene blue does, is it starts getting the energy metabolism upregulated everywhere throughout your body, but especially inside the brain, because that's where it tends to go selectively. Now, you have something inside your cells, the mitochondria, that produce energy. And you have something called the electron transport chain that takes the molecules from the Krebs cycle, pushes them through this four complex sequence to make ATP, the primary energy molecule in your body, adenosine triphosphate. Well, lo and behold, everything you do in your body to do something good, you do something bad. That's because in order to make and transport energy, you have to use up energy elsewhere, and in the process, create what's called increased oxidative stress, more oxidized biomolecules. Well, guess what happens is methylene blue comes in and it shortcuts the first three steps of the electron chain and directly gives electrons to the fourth stage so that it stimulates the production of greater amounts of ATP without generating any oxidative stress in the process. And this, not only in the brain for thinking more clearly, but this is why when people start taking this, and it happened with me, I mean, I couldn't believe it, is you start seeing and feeling energy that you never felt before. And it's got no significant toxicity except when you get in crazy high doses, but that's the case with anything. I don't think there's anything, actually, except for vitamin C, that has no definable toxicity. And just about anything that's good can kill you or mess you up if you take too much of it. That's just basic science, basic biology. But the zone of safety is extremely great with methylene blue. It's very, very difficult to get yourself in a situation where there's any significant toxicity at all. And the literature, that was what was really mind-boggling to me. Probably the most compelling articles that I saw in methylene blue was in patients with advanced septic shock. Now, with advanced septic shock, your blood pressure is disappearing. And even though you're taking lots of vasopressors, the blood pressure doesn't come back. So anyway, in two different cases, one of them I think was a COVID septic shock. I don't recall for certain. These patients were going steadily downhill. They're getting everything that modern medicine had to offer. And fortunately, the doctors in this case were aware of methylene blue. And so, what a sequence. This patient deteriorated, coded, was resuscitated. And then they started him on methylene blue. And over the next day, he started getting better and better and better. And then they stopped it. And the patient crashed again, coded again, and they started the methylene blue again, continued it for a week, and the patient walked out of the hospital. So, and I'm not emphasizing or trying to advise people that it should be a monotherapy. I mean, there's lots of good things that can help you, and you should take a combination as much as possible. But it needs to be emphasized that the ability of methylene blue in this particular case was, and there's a lot of other literature supporting this, not just these two case reports that I'm talking about, is it's very effective as a monotherapy. It does a lot of great stuff for you all by itself. Now, I'm not saying don't take your vitamin D, don't take your vitamin C or anything silly like that. I mean, the more you build up your antioxidant matrix inside your body, where all the electrons are getting exchanged back and forth, the healthier you get. And this also brings up what I realized when I was doing this paper and then have done some additional research is the power of an antioxidant is its ability to distribute electrons, not to primarily donate them. So by this, I mean, when you have vitamin C, you can give vitamin C, believe it or not, in its reduced or oxidized form and have equal clinical impact because you need the new electrons from your diet and then the vitamin C distributes them. Same thing with methylene blue. They have articles in literature that show methylene blue given in its reduced state or given in its oxidized state has an equally powerful clinical impact. And this is something that has not been emphasized in the reduction oxidation biology of the world, which is it's not the new electrons that are antioxidants bringing in that are a primary benefit. It's that you create more buses, you create more distribution network. So the more molecules you have, the wider the electrons can be distributed. You know, if you have a trucking company and you have 3 trucks, you're not going to distribute much, no matter what's in them. If you have 100 trucks, you're going to distribute a lot. And may or may not sound like a silly metaphor, but that's exactly what's taking place. So vitamin C and methylene blue are premier electron distribution agents.
Because that's what health actually is when you boil things down to its real basic fundamentals, when you get down to the lowest point. Health is that transfer of electrons, right? It's the current, like you said, like you've stated before. And that's not
Health
really
is electron supply. Health is electron supply and getting the electrons where they need to go and repairing the molecules that have been damaged by having their electrons taken away. That may seem to some people to be too simplistic, but I guarantee you that's exactly it. There are 2 phases to effective treatment of anything. One is repair, okay, which is good antioxidants, bringing oxidized biomolecules back to their reduced, normally functioning state. And there's prevention. And prevention is turning off the new toxin sources. Now, that's simple. I'm not saying clinical therapy is simple. There's a lot of complications involved in getting the right protocol for certain patients. But we've gotten to the point now where when you include 3 or 4 basic things in your treatment of anything, you're going to start getting improvement. And that's the things that target the toxins, target the pathogens that are creating the toxins, which is always the case. I mean, unless you have something silly in your life, like you're living next to a fertilizer factory and you're inhaling pesticides all day long, that's one thing. But outside of that situation, if you're sick because you have foci of pathogens in in the affected tissue that you have disease, and it's their metabolism that continues to produce the toxins to keep the disease going. It's called chronic pathogen colonization. We've got it documented in the brain, in the heart, in the gut, nearly every organ you can think of that they've looked. You have chronic pathogen colonization, and almost always the pathogens are typical for oral pathogens. So we come back to root canals, other infected teeth, infected gums, and infected tonsils. Those are the reasons for nearly all conditions and the worsening of all diseases.
Really? That's quite fascinating.
Absolutely.
So why is that?
I have an article coming out right now.
Metals in the mouth, is it, or?
Well, no, not the metals. I have an article that's coming out any day now. It's entitled "Root Canals Cause Breast Cancer Frequently." I mean, I've tried to emphasize this in so many other ways, and women from around the world, I had this cancer, that, or the other. How much vitamin C should I take? And I said, wait a second, I write back. Here's a book, Hidden Epidemic. Almost always it's coming from your mouth, and you need to see the dentist, the right dentist, biological dentist, and you need to get a cone beam examination, and I write it back. And I guess okay, but how much vitamin C do I take? I mean, the point is completely missed. And it's a tragedy because in the mouth, these teeth, and we have the documentation, it's all going to be in this new paper coming out. You have isolated the pathogens in the breast tissue. The lymphatic drainage is going from these teeth into the breast tissue. And when the lymph gets overwhelming and sluggish, you get a cancer. There's not any disease at all that develops until you have a focus of excessive increased oxidative stress, oxidated biomolecules, in a chronic fashion. And when the oxidative level is extremely high, you go from just having a chronic non-malignant disease into a malignant or cancerous disease. And it's really that simple. I mean, it's the etiology is so elegantly straightforward, okay, in all chronic diseases. Everything is oxidative stress. An earlier article I wrote is that toxins cause all cardiomyopathies, congestive heart failure. In patients that were being screened for heart transplantation, they had the big, dilated hearts, horrible, floppy, not contracting well. And they did biopsies, as they usually do, but in this case, they also did heavy metal levels, heavy metal concentrations. Now, listen to this. And this was not the exception. This was the rule in just about everyone that they tested this way. They found 22,000 times, that's 2,200,000% more mercury inside the heart failure tissue than in normal heart tissue. They found 1,100,000% more antimony inside the heart tissue than normal tissue. Why so much mercury? Well, guess what? That's where it's been going from the generations of people that we've had with mercury fillings and the vapor going up into their brain, into the rest of their body. And it's really amazing when you do proper chelation, you start pulling these metals out. Lo and behold, this entity called congestive cardiomyopathy that cardiologists around the world think is irreversible is not irreversible. I mean, there are some people that will reverse, but very many of them, if you chelate them right and you give them ATP-stimulating agents such as niacinamide, riboflavin, coenzyme Q10, and methylene blue, you jack up that energy production, you pull the toxins out, and guess what? The heart starts contracting better again. I mean, not quickly. These are things that evolved over a long period of time, so the return to health is slow, but it's steady and it's predictable.
Yeah, that is really remarkable to hear, because especially when you mention mercury now as well, because mercury is so toxic to the body. And I believe as well, if I'm right in saying that it can pass the blood-brain barrier. Is that right, Dr. Levy?
Oh, yeah. No, it goes to the blood in the brain very easily. Something also not acknowledged by quote unquote modern medicine is mercury fillings. From what I've seen, and I spent a lot of time with Dr. Huggins looking at this and watching what he did, most cases of multiple sclerosis and many other neurological diseases are just the fact that they've had mercury accumulation. And unfortunately, they or their healthcare practitioners really don't have a clue. But I've also seen patients already with multiple sclerosis get better, significantly better, when they start chelating out the mercury, saunas, DMSA, other agents. A lot of natural agents, too, are good chelators. But all of these things mobilizes the mercury, and patients get better. Patients get better from conditions that medicine considers to be irreversible. It's sad. It's tragic, okay? And once again, no mention of any of this in the textbooks of medicine. Even though this article in 1999, it was I think it was in the Journal of the American College of Cardiology. So it's in the subspecialist journal. I don't know what everybody did. They must have just looked at it and laughed and said, wow, what a crazy article that is. I don't know. I did see the article myself, and it only made sense to me recently and not at the time. So I'm not saying that somebody is bad intentioned if they don't realize something at the time, because we're all a function of the knowledge that we have and the situation that we have. And there's many times when a certain fact pattern hits you in the face and nothing sinks in. And then months or years later, a similar fact pattern hits you and you have the light go on.
Yeah.
But anyway, the data is there. It's not at all hidden. It's in mainstream journals. And as the article shows, there's a lot of other heavy metals that cause a great deal of damage to the heart. Copper among them. Copper is the people that promote taking copper as a supplementation is horrible. You should never.
Is that right?
Never.
I actually thought copper
That's
was
right.
I bought into the whole copper thing. I bought into that.
No. I have another article called The Toxic Nutrient Triad: calcium, copper, and iron. You absolutely need them for life, but above a certain level, and I don't say this just to be dramatic, you need them for death. Calcium, iron, and copper are the primary players in determining when a cell dies, when the levels get too high. So, and all the data is there. But the thing is they say, oh, well, copper or iron does so many things that are important in the body. Yes, that's true. But they're doing it as cofactors. Okay, so it's not like they're a substrate being used up. They're just being swapped back and forth to power enzymes that they're needed for. That takes a very tiny amount of iron, a very tiny amount of copper. And when you just think, oh, well, it helps all these enzymes, it must be good, I'm going to take a lot more. No. It all breaks apart then, because these are heavy metals, and not both, but iron, copper, and calcium are the primary promoters of increased oxidative stress inside your cells. And as we just said earlier, increased oxidative stress, increased oxidized biomolecules, that is the foundation of all disease. I mean, when you have a Alzheimer's cell, okay, it doesn't have Alzheimer's disease. It doesn't have some unique, ill-defined thing that's making the cell sick. What it has is its own unique array, concentration, and location of oxidized biomolecules, nothing more.
So I think it'd be worth it then if we touch more on what oxidative stress actually is. Would you mind, Dr. Levy, going into a bit of the science behind what oxidative stress really is?
Well, oxidative stress is probably not used this way in the literature, but the literature does say, with any disease that you can find, type in any disease that you can think of in PubMed, whatever, diabetes, high blood pressure, whatever, and then oxidative stress. And you're going to see a whole host of articles showing that there is increased oxidative stress in those diseases. But they consider it a correlation or association, this, that, or the other. No, it's cause and effect. Once again, the primary idea is that it's called redox biology, reduction oxidation biology. And again, it's based on the fact what I just said is that all disease is oxidation. Now, that's not to say that oxidation is always bad. Your normal physiology generates oxidation, and that's what you call a physiological level of oxidation. But that low level is important because it triggers things to react and bring reduction and antioxidants back in. But when the balance gets skewed, when the antioxidant level gets low and or the toxin level gets high, pro-oxidant, you have a poorly functioning cell because too many of the biomolecules are oxidized. It's that simple. And also important are synonyms. Toxin equals pro-oxidant equals free radical equals reactive oxygen species equals poison. They all mean the same thing. When you get poisoned by something, it means the toxin chemical configuration caused it to focus on a specific area that was very critical to your health acutely. I mean, you can inhale the mercury vapor from your fillings all day long and not clearly have a problem until maybe you develop multiple sclerosis or congestive heart failure 20 years later. But it's still oxidative stress is doing that. On the other hand, if you inhale hydrogen cyanide in the nose, it just because of the chemical nature of the toxin, it goes directly into the respiratory cells that utilize oxygen, oxidizes or poisons those enzymes so that you can't pull oxygen in anymore. And obviously, if you can't pull oxygen in, you die in a minute or two. But it's still oxidative damage and nothing else.
Very interesting, very fascinating.
Incidentally, anybody that's listed, I have a whole list of articles, and I have no problem at all with people sending me a request to my email, televy@yahoo.com, and I'll give them a whole list of these articles, well documented. That's not me saying stuff crazy that's not in the literature. It's just, to the best of my knowledge, the literature has never been coalesced and correlated in this fashion. And there's also 3 or 4 books that I offer the public as ebooks for free if they want.
Fantastic. I think what will be useful as well is that if we just link them below in the description box, Dr. Levy, if you email me those links, and I'll put them in the description box, and everybody got access to them straight away. So if they want them, it's all there. So I've also been told then that methylene blue. So we've touched then on what methylene blue can do for the cell. So we can skip that 4-phase process, right, of the cell, go right to the front, and then provide all the benefits. I've also been told that methylene blue is also a heavy metal detoxifier. Is that correct, or is that not true?
Well, I don't know that I've run into literature that specifically asserts that, but I will say any powerful antioxidant that gets everywhere it needs to go in the body, well, guess what an antioxidant does also? Once it's inside your cell, if you have toxins inside your cell, it increases oxidation inside your cell, and your enzymes that help you eliminate toxins are oxidized. When you oxidize an enzyme, you render it useless. You no longer have an enzyme function. So to the degree then that it can reduce critical antioxidant enzymes and chelation type enzymes, yes, I don't know that it has a direct chelating effect, but I'm certain it has a toxin mobilizing effect so that, potato, tomato, I think you're still getting definitely a chelation effect, yes.
Yeah, that's good to know because, we're bombarded now, aren't we? Really, with heavy metals in all forms, in different ways, pesticides from our food, and the
Well, one thing I
level
noticed
of
when I wrote the paper on cardiomyopathy, remember I told you that in addition to having 22,000-fold more mercury in the heart, you had 1,100-fold more antimony. Oh, who talks about antimony? Well, it's also a toxic heavy metal, and one of its major sources is plastics. So what are we doing all day long? Now, I'm sure there are some plastics that are safe. I don't know which one they are. I can't give you a breakdown on the different construction of German plastics to tell you which ones do, which ones don't. Maybe they all do. I don't know. But a lot of antimony in the plastics. So you have water bottles of this, what are we sucking? Go with glass. Go with glass. Go with glass. Okay. They had a fascinating article, Reese, and I don't know what caused them to think about it. Maybe because they were getting crazy results and they had to recheck it. They were testing blood of patients for antimony. And they collected the blood in the plastic container and the blood in the glass container, and the one in the plastic container, which it doesn't sit there that long, remember. You draw blood and it sits there a while and then you go run it. It doesn't sit in that vial for days, weeks, months, or years. And there was substantially more antimony in the blood that was collected in the plastic vial than the glass vial. So this is something that I don't think anybody's been addressing. But gosh, if you have over 1,000-fold more of something inside a tissue that's failing, I think we should consider that a toxic effect.
absolutely, yeah. I've discussed before on different podcasts about the effects of plastic on our testosterone levels, males' testosterone levels, and how they drastically impact.
Well, interesting point. It'd be interesting to see, and I don't know. I haven't researched it to see what effect antimony has on testosterone levels.
Yeah,
Could be worth looking at.
Absolutely. Yeah, I mean, I'm pretty sure. Really, what I've just learned over the sort of, so Dr. Levy, I'm 28 now, and over the last 8 years or so, I've been on this, a real health journey. I'd say just learning the real truth about what health really is.
On your personal odyssey, yes.
Yeah, exactly. I'm always looking for ways that we can, boost our health and boost especially our brain. I have a bit of not an obsession, but it's just it's something that I'm really focused on is boosting my cognitive function. And I'm seeing that now with methylene blue. I mean, I can't recommend it enough, really. Some of the things I really want to touch on as well, which you might be able to elaborate on, is the microbiome and the effects of methylene blue, because I've done a lot of research personally on the microbiome and how so vital that is, and it's not talked about in mainstream medicine, in mainstream pharmaceutical medicine. It's just not mentioned really at all. And how we are destroying the microbiome through all these pharmaceuticals, all these toxins and everything else. And it's often one of the causes really of poor health. So would you mind expanding on, if you wouldn't mind, just sharing your knowledge on the microbiome if you have any? And
sure,
if methylene blue will negatively impact the microbiome in any way, or
there'll be a very positive impact on it. But it's first important to realize the etiology, the reason for abnormal gut conditions, which are almost always due to an abnormal microbiome that has a greater percentage of pathogens versus good bugs, that then cause oxidative stress and poison the ileum so that you get a leaky gut syndrome, so that toxins and pathogens and their products easily go into the bloodstream rather than be filtered out. And then that's the big vicious circle that disseminates pathogens and toxins throughout your body. But it all comes from the mouth. It all comes from the nasal areas, the throat, everything else. When you clean out the mouth, clean out the tonsils, get rid of the pathogen colonization, chronic pathogen colonization inside your nose and throat and upper respiratory tract, the gut heals like you wouldn't believe. I came across this when I first started working with and studying on hydrogen peroxide nebulization. I wrote a book on it in 2021 to deal with COVID, which is extremely effective at. It'll knock COVID out all by itself early on, and actually it'll knock it out all by itself late in stages. Now, again, I'm not recommending somebody do that and nothing else, but it's a very powerful tool. Why is it so powerful? Well, whenever you have bugs from a cold, flu, anything, maybe you had the cold 5 years ago, 10 years ago, if you never took a biofilm stripping agent, biofilm, once pathogens get on the mucosal surface, they quickly build a protective biofilm on top of them. No antibiotic in existence can penetrate that biofilm. So you could have treated yourself with 100 different antibiotics for 100 different reasons. You still have this pathogen colonization in your nose and in your throat from the last time you had the cold and the flu 1 year, 5 years, 10 years, 20 years earlier, unless you took a biofilm stripping procedure, which is hydrogen peroxide, strips out. I'm not saying it's the only thing, but it's by far and away the easiest and cheapest and most biologically and physiologically effective. The peroxide strips out the biofilm, kills the pathogens, and in days, your gut function starts to improve dramatically. I've had people write me in, a child with a teenager with Crohn's disease, horrible, just incapacitated for years, starting nebulizing with the peroxide. In 1 month, he was completely normal. And now that's considered a chronic, incurable disease. And now he's growing again. He's athletic. I mean, and I've had people with mold toxicity. I mean, so horrible. They had to move out of their house. The family's in the ICU. Start nebulizing the hydrogen peroxide. It all disappears, and it all disappears quickly. In your gut, it's oxidative damage. So what are you doing when you have this chronic pathogen colonization is, like the young people say, 24/7, you're swallowing pathogens, you're swallowing the toxins that they make, and when they do finally die, guess what happens? Pathogens thrive on iron, so when they rupture and die, they release a whole ton of free iron, which, remember I just said, along with copper and calcium, are your two most incredibly pro-oxidant toxic substances they are when they get above a certain level. Anecdotally, let me give you a little anecdote as to what started all this thinking. About 6 years ago, before the pandemic, I wanted to take care of my sinuses. I was researching on my magnesium book, and I ran across nebulization. And I knew what nebulization was, but I'd never really thought about it. Nebulization, of course, for anyone listening, is where you put something into a fine mist and you breathe it in and out and inhale it. Usually different lung conditions, etc. Well, I'd had sinus problem my whole life, so I said, well, let me look a little about nebulization. And I ran across peroxide. I said, wow, that looks like a very good agent. So one day I took out my nebulization mask and nebulized hydrogen peroxide for like 10 or 15 minutes. And having no idea this would happen at all, none whatsoever. The next day, and I'm like 66 years old at the time, the next day, I have the most incredible, perfect, well-formed bowel movement I've ever had in my life. Never had one like that in 66 years of life. That's how quickly it normalized the gut. For me, now some people that have more gut conditions, it'll take a few days or a few weeks. But the thing is the cells in your gut that are supposed to the cells in your gut that form a leaky gut, when they get oxidized and spread apart, they left stuff in. Guess what? You have stem cells in your intestine that give you a new cell every 3 to 5 days, which means if you stop poisoning the gut from above, in 3 to 4 days, you've got a new gut lining. You just got to stop poisoning it on a chronic basis. And I tell you what, before I wrote the book, Rapid Virus Recovery, this was so dramatic, and the information I was gathering was so impressive, I was thinking of calling the book Rapid Gut Recovery. But it was in the context of the pandemic, and it was much more important to get the concept out there that, well, if you read the book, you'll know it takes care of the gut too. But the most important point for people around the world to get was that when you nebulize hydrogen peroxide correctly, you'll knock out any acute infectious agent of any kind. Any virus, any COVID, any bacteria, anything. And you'll positively impact the gut function. I mean, I had young women that have had years of irritable bowel syndrome, diarrhea all the time. Peroxide nebulization, within a week or two, they're having normal bowel movements. It's pretty amazing stuff.
So we can say then confidently that methylene blue then is not going to negatively impact the microbiome.
Oh, not at all. Not at all. I mean, it's yeah, sure. But the thing is you want to use the methylene blue. You still need to knock out the chronic pathogen colonization. Now, if the methylene blue, if you take it in a manner so that it contacts all the tissues, like you gargle with it or something like that, or some people have even nebulized methylene blue, but you deal with a little bit of blue staining there that a lot of people might not want to deal with. So the hydrogen peroxide, no problem with any of that. So they're a tremendous combo. Nebulize with the hydrogen peroxide and take the methylene blue, and whatever the people get my email, if you do this and you get results, write me and tell me about it. I want the feedback. Or if something untoward happens, tell me about that too. But my clinical experience is arm's length now, so I need people to let me know. Let me know. I've had a lot of positive experience already, but it's always good. Educates me more, and I can educate other people. I mean, education is a sequential donation process, right?
For sure. Yeah. No, I'm truly grateful for everything that you're saying so far. It's actually really, really fascinating. There was something that I wanted to quickly mention as well, was a book that you spoke about in one of the podcasts I watched. It was called Brain Energy. You're probably familiar with it, or you probably remember it rather, by Christopher Palmer. Does that ring any bells?
No, that's not a book that I've read, I don't believe.
Huh. Okay. It was I definitely discovered it by a podcast that you were in. Maybe it was the host that was talking about it.
Yes, correct.
But it was, so his theory, Christopher Palmer, is actually very, very fascinating. So he's a psychiatrist, from Harvard Medical School, and so his theory is that mental health issues are caused by they're a metabolic issue. I believe I'm getting the terminology correct. In other words, so the cells in the brain don't have the energy or the function. So yeah, they don't have the energy to function properly, which causes the mental health issues. I don't know if you're familiar with this theory or if you hear much about this.
His particular theory, no, but it sounds like what I just wrote about would fit in perfectly with that. I wrote an article that says schizophrenia is chronic encephalitis, and niacin cures it. And all the documentation is there. And
Cool. Yeah.
And it's inflammation. What is inflammation? Inflammation is oxidative stress. We're coming back to the whole thing. It's just, what about a certain process gets it? Well, when you're very low on niacin, you don't have anything close to the substrate that you need for the first stage of that 4-stage electron transport chain. And as soon as you start taking niacin or niacinamide, the NAD levels rise up in your brain and you start producing more energy, more ATP. And let me tell you, I don't care what the disease is, what the pathology is, nothing. If you increase ATP production inside a cell, it's going to get better or it's going to be completely cured. One of the two. Okay. So, and I mean, this dramatically applies to schizophrenia, but depression, uh, manic depression, cognitive problems, the whole ball of wax, okay? We tend not to think of mental disorders as having physical basis, but obviously it has to, just because you have a combination of cells that are producing something as exotic as a thought doesn't mean that they still don't have physiological principles that have to keep them well so that they can do whatever this glorious process is of turning something physical into something ethereal. But no,
it makes
niacin
makes perfect sense, doesn't it? Really, when you think of it, like if the cells in the brain aren't functioning to their highest capability, then obviously there's going to be some kind of impairment going on in the brain, right? And that would manifest in your thoughts, because that's where our thoughts are. So it just makes sense, really, when you think about
it, there's a something that's not used a lot, but is very effective in all walks of life, but especially in medicine, is common sense.
Common sense.
And it's also,
I knew you were going to say that.
Also having an open mind. So many people, I think we're all subject to it to one degree or another, but some people severely, which is you have to be open to everything. And so many people will just immediately shut themselves down if what you're suggesting or proposing is going to change the way they do things. I mean, tell me what you want, but don't mess up my lifestyle, my protocol, my way of living, my generation of income, this, that, or the other. So
Cognitive
first and
dissonance.
foremost, we need people to be objective scientific thinkers who, and I will be judgmental here, care about people. I mean, after this pandemic, if anybody thinks the medical system as a whole has the best interest of the patients in mind, I don't know what planet they're living on.
Yeah, it makes you wonder, doesn't it, Dr. Levy, like how people could still put their blind trust in a system.
In many
like
ways, long term, that might be the biggest positive impact of the pandemic, is it's finally getting a large portion of the public to no longer trust the fraud and evil institution called modern medicine.
Absolutely. So I'm a conscious of the time. We've almost been going for an hour now, and it seems like we could probably go for another 2 hours. I just want to quickly touch more on methylene blue and its benefits. So we've discussed the science, which is fascinating. Could you then just explain in what the benefits actually are of taking? So we know it's a nootropic, right? It's good for the brain, it's good for cell function, brain boost, and everything else, and it's an antioxidant. So what cognitive benefits are we going to experience from taking methylene blue?
Well, no two people are the same, but anybody, as we discussed, that gets increased ATP production inside their brain, it's all going to get better. There's going to be less. I mean, there have been some patients who have taken a reasonable dose of methylene blue that were depressed, and their depression is gone immediately within a day or two. But I mean, not some big prolonged thing. It just shows you that, not surprisingly, the brain is starved of micronutrients, okay, amongst the other things, and the micronutrients, but first and foremost, is starved of energy. Obviously, and this is covered in the paper too, with methylene blue, especially for central nervous system disorders, I mean, you need good balanced supplementation too. You need all the building blocks for the antioxidant ability of the methylene blue to be expressed, okay? So, but You can bolster it. You can support it. With the brain, you take the niacinamide, which brings up the NAD. You take riboflavin, which is vitamin B2, which builds up the second step. You take coenzyme Q10, which is the third step, and then the methylene blue, which is the fourth step. That is the most powerful 4-supplement sequence that I know of for supporting and stimulating and promoting ATP synthesis. I mean, there's literally thousands of supplements you can take out there. So people ask me all the time, what should I take? Well, there's a lot of stuff you can take if you can afford it, if your stomach doesn't get upset, et cetera, et cetera. But the ones that I consider essential are vitamin C, magnesium, vitamin D2, and vitamin K2. All of those bring the toxic calcium levels down inside your cell that promotes all disease. And then the other 4 are what I just mentioned, which is niacinamide, riboflavin, coenzyme Q10, and methylene blue. Those 8 together is one of the most powerful supplement packages I've ever encountered in my life. It's done incredible things for my own personal health. And so before people start asking, what about this? What about this? What about this? What about this? There's hundreds, if not thousands, of other good supplements out there. And I'm not saying don't take them. I am saying if you want something for maximal bang for your buck and your health, I would take these 8. Definitely the front 4. I mean, you're not going anywhere when your vitamin C levels get low and your magnesium levels get low and your vitamin D levels get low. You got to have that. But then after that, you need to chase the ones that optimize energy production.
Very, very fascinating. Very fascinating. Are there any final thoughts, Dr. Levy? Anything that you really want to mention that you haven't had chance to mention yet?
Well, for anybody interested enough to watch this, they already have defined themselves as being reasonably motivated to learn about their health, etc. First and foremost, never go to a traditional dentist. You got to find a biological dentist. I've said many times, and I'll say it again. Having a traditional dentist is the worst thing you can do for your health. Having a good biological dentist who knows how to use ozone and diagnose infections well and treat them is the best thing you can do for your health. So, if you have a root canal and you decide to get it taken out or something like that, and you go to a traditional dentist, don't. They're going to take it out and leave the infection in the socket. There are things that need to be done. Point being is your choice of healthcare practitioner is critical. You shouldn't ever go. I mean, if a physician doesn't want to answer your questions or feels intimidated by your questions or doesn't want to try to explain things to you, don't walk out of that office, run out of that office. I'm still overwhelmed by the people that write me that they're seeing their doctors and, well, that's interesting, but my doctor wouldn't like it or this, that, or the other. So I'm saying, and I don't write this. I think this. I said, why on earth are you talking to me? Why are you I mean, you have to start with the fact that most of the time, I'll make a generalization, most of the time, with regard to true pathophysiology, your doctor doesn't know what the heck he or she is doing, okay? And doesn't really care. That's even the worst part. Yeah. They don't care about understanding. They care about having something that might make a symptom go away, file with the insurance, and move along to the next one. And I'm sorry, but anybody, like I said, that's been through the pandemic that thinks most doctors truly care about you as their primary concern, hey, you're just not very observant. So find a good integrative medical practitioner, find a good biological dentist, and those are the 2 big steps toward carving a way toward improved and optimal health in the future.
Well said. Well said. That was brilliant. And just to quickly finish up here. So, methylene blue in its purest form. So, anybody who is interested in taking methylene blue, So it was first used as a dye. So it's incredibly dark blue. So there is a way, Dr. Levy, isn't there, to sort of to not dilute it, but to change that color, isn't it? To make it a bit lighter so you don't get the staining in the mouth. Is there like an optimal way to take methylene blue?
The optimal way is doing it carefully. But the thing is for a long time, I would just mix the methylene blue with some tomato juice or V8 and then sip it through a straw, okay? And avoid, I mean, you're going to still get your tongue colored for a period of time, not days or weeks, but a few hours, and then that'll resolve, especially the more you take the straw to the back of your tongue, you can avoid that staining completely. But no, I mean, methylene blue contacts your skin. You got blue skin for at least a week.
So
When it first hits your skin, if you immediately put rubbing alcohol or hydrogen peroxide on it under a faucet, you'll get it all off. But if you let it sit there for more than 3 or 4 minutes, you've got a blue spot for a week.
what about ascorbic acid? Mixing it with ascorbic
When you
acid.
add ascorbic acid to methylene blue, it will clarify and clear the solution. But that's not to say that you can still just casually sip on that, because what contacts your lips will still convert back and cause the blue. So that's not a surefire way, just because you've clarified the solution, that the methylene blue is not going to have the staining effect if you're not careful in how you take it.
Gotcha. Right. Okay. Well, I mean, I think we've covered